Recently, there's been increased attention being paid in the media and by politicians to the issue of drug addiction that is plaguing today's society. The National Center for Drug Abuse Statistics recently reported that 13.5% of Americans 12 and over have used drugs in just the last month, almost a 4% increase year over year. Sadly, the report also found that half of all Americans 12 and over have used illicit drugs at least once in their lifetime, and the number of drug overdose deaths in the U.S. since 2000 is nearing a staggering 1 million. One particular type of drug, opioids, accounts for almost 3/4 of all overdose deaths. Deaths which have increased almost 520% from 1999 to 2019. This despite the fact the federal government has budgeted about $35 billion each year for drug control. Suffice it to say, the opioid epidemic in particular continues to devastate communities across the country, which is driving much of the conversation and concern. But one part of the issue that is being left out of the conversation is that it is primarily men and boys that are being affected. While any death due to addiction is tragic, one of the most alarming statistics comes from a recent California report that found that boys and men accounted for 78% of all opioid deaths. This staggering gender disparity raises critical questions, ones that need to be part of the discussion if we want to address the issue in any meaningful way. We need to be asking, why are men and boys so disproportionately affected, and why is this disparity largely being ignored by politicians and academia? In a society where every issue is gendered, why aren't we having an honest, frank discussion about the fact that it is men and boys who are most affected by the plague of drug addiction, and why aren't efforts to address the issue reflecting that? One possible reason lies in societal pressures and the stigma surrounding mental health and vulnerability for men. Studies have consistently shown that men are less likely to seek help for mental health issues, which are often intertwined with substance abuse. The expectation that they should just be able to man up or tough it out can and has driven many men to self-medicate through alcohol and drugs, and in ever-increasing numbers is causing them to turn to opioids and other similar substances in order to cope. But there's another dimension to the issue, one that no one wants to allow into the discussion, let alone address in any meaningful way: the growing demonization of men and boys. For decades now, politicians, Hollywood, the media, cultural narratives, even academic discussions have portrayed men as inherently problematic and/or dangerous. They've told men and boys from birth that they are to blame for all of society's ills, not just now, but going back for millennia. They've had it drilled into them from birth that they need to feel guilty, feel shame for things they had no part in, and because of that, they need to be punished for the wrongs of society, both currently and historically. It's a heavy weight to bear for anyone, especially considering how relentless it is. So is it any wonder why today's boys and young men are struggling with their identity? Should we be surprised that men and boys are having mental health issues and a self-identity crisis when they've been told day after day that they're inherently bad, simply because they happen to be born male? Add to it, society as a whole is largely choosing to ignore the complex struggles these men and boys face. Instead of showing them caring or compassion, the most common thing that is done is for them to be mocked and made fun of. More often than not, they're told that even having struggles of any kind, means they're unmanly or weak. This harmful rhetoric has led to a lack of focus on the issues of men and boys and their well-being, particularly when it comes to health crises like the opioid epidemic. An excellent example of what is going on was in the recent election, where one party essentially made the majority of their campaign about women's rights and women's health issues. Throughout the campaigns, there wasn't a single discussion by either party about men's rights, men's issues, or men's health. Not one. And yet pundits even now are asking, Why did men vote the way they did? Why did they as a group reject the party that essentially has demonized them and said their issues don't matter? Only those that women face are worthy of attention and discussion. But it runs much deeper than that. Ask yourself, when was the last time you heard anything about men, their issues, their health, and their bodies at all? It's not covered in the media, not talked about by politicians, and largely not studied by academia. And again, we must ask, why? The answer, and the only logical conclusion, is that they simply don't care. They simply don't value men and boys in any way, or see them as important to society. If anything, they see men as disposable, something to be used and then discarded. And that's exactly how many men and boys see themselves now. They see themselves as unworthy, unwanted, and unneeded. They see that society doesn't care about them and doesn't want to hear about their struggles. And it's why so many are turning to drugs and alcohol in order to try and cope. The fact of the matter is that research has shown time and again that societal alienation and the lack of support only exacerbates mental health struggles, particularly in men. This in turn is what is driving men and boys to higher rates of substance abuse and suicide. But rather than acknowledge that fact, let alone discuss or address it, society as a whole ignores it, or even resorts to blaming the men for it. Let's face it, victim blaming of men has become a national sport, one that is in fact often cheered and used to drive agendas in favor of women. Witness the most recent election. It's why we're seeing more and more men withdraw from society and turning to drugs, especially opioids, as often they see no other option. It's long past time for politicians, academia, and public health officials to acknowledge these facts and address this disparity head on. It's time we had an open discussion on the vilification of men, the toxic war against masculinity, and how the agenda to do so is harming not just men and boys, but society as a whole. It's time we focused on the needs of men and boys and addressed the issues they face by creating targeted interventions that recognize the unique challenges facing men and boys. And it's time we practice gender equality instead of paying mere lip service to it in the pursuit of political and ideological agendas. The good news is, it's not just me or those of us who speak out on behalf of men and boys and the issues they face saying it. It is now becoming a national conversation. If nothing else, the recent election showed that men are not going to stand silent and be ignored anymore. They spoke loudly and clearly, and they're going to be watching to see what happens in the next 2 to 4 years. Will their concerns be heard? Will their issues be addressed? Only time will tell, but the fact is, if we continue to ignore the realities that men face, the issues are only going to continue to perpetuate the suffering of countless individuals and families, and indeed society as a whole. We need to stop treating men's struggles as a taboo topic, or worse, one that needs to be mocked and ridiculed. If we truly want to tackle things like the opioid epidemic in any meaningful manner, then we as a society need to take the well-being of men and boys seriously.